Hi, Dr. Gominack here. I'm a neurologist. I'm very interested in how the brain controls our ability to sleep, how our brain controls the ability to get normally paralyzed in sleep. The most important discovery in this field in the last few years has been our linkage between the two cycles of our planet and our sleep system. You know about the circadian rhythm. The circadian rhythm, the 24-hour cycle, day-night, is linked through sunlight passing through the eye into retinoids like vitamin A that entrain our brain into a 24-hour sleep-wake cycle. What you didn't know was that our brain is also linked to the annual cycle. Winter-summer, allowing us to sleep longer in the winter. It's linked in this case not through sunlight through the eye, but sunlight through the skin that makes vitamin D. Vitamin D is an endocrine hormone that allows us to adjust our fertility, our sleep, and our metabolism to the summer-winter cycle. Once learning about that connection, we can use what we know about vitamin D and the effects of vitamin D on the microbiome to correct this brain-based endocrine disorder that has been in the background all of this time in our sleep-disordered patients. It's been overlooked, but playing a very important role. Come to my lecture, 3 simple steps for healthier sleep. I'll teach you how to intervene and add this treatment protocol to any of the modalities you're using now.